right, good morning, good afternoon, and good evening, depending on where you find yourself in the world. My name is Sophia Arend, and I am the Global Blockchain Business Council's Senior Analyst. It's my pleasure to welcome you to the GBBC's Virtual Members Forum. This is a bi-weekly webinar showcasing the innovative work of our members around the world. And today we have the pleasure to be joined by Ran Melamed, Head of Business Development for Orbs. He will be presenting and leading a live Q&A on the blockchain-based health passport Orbs is developing amidst the coronavirus pandemic. Before I hand things over to Ran, I would like to briefly introduce him. Ran is based in Singapore and leads Orbs' global business development operations. He has over 15 years of experience in the Israeli high-tech industry, and prior to joining Orbs, he was a founder of a technology startup, worked in M&A and venture capital, and was part of the investment team for a technology growth investment fund. Ran holds a degree in physics and a master's in economics from Tel Aviv University and is a veteran of the elite section of the IDF 8200 unit. We are so pleased to have Ran here with us presenting on this very timely topic and solution. We would welcome your questions at any point during today's webinar. You can submit them in the Q&A tab at the bottom of your Zoom screen, and we'll take them at the end of Ran's presentation. Without further ado, I'd like to hand things off to him to get started. Thank you.
Thank you very much, Sophia. Hello, everybody. Just share my screen. Just 1 second. Sorry, just 1 second. Can you see my screen, Sophia?
No, I can't. I just see.
Sorry about that.
No problem.
What's going on?
It doesn't seem to be loading. Is it, are you?
Maybe.
There we go.
Great. So sorry about that. Thank you, Sophia. Thank you for GBBC for having me at this webinar. Hello, everybody. My name is Ran. As Sophia mentioned, I'm Head of Business Development for Orbs. And I would like to talk at this session about the solution that we've designed and currently in discussion with a certain government on deployment. Now, obviously, COVID-19 is a hot topic and concerns everybody. The main, I'd say our motivation was originally Orbs, and I will talk about it in a second, but Orbs develops a blockchain protocol for corporates. And as soon as COVID-19 started to hit severely and everybody realized that unfortunately, it's here to stay and it is going to have a major impact and change things. So we try to think, what can we do and how can we try and harness our technology into something that, again, would not only be commercially, effective for us as a company, but also try to do something that is more than that and maybe can assist in opening up economies and trying to make the situation better. Again, few words about this solution. We do not proclaim to have an hermetic solution. Obviously, there's still quite a lot open questions that are up for decision for the countries who would like to deploy, especially the country that we're now in discussions. And the idea is not to provide a 100% remedy for world travel and trying to remove the restrictions. Obviously, we realize that in our view, such a solution would be very hard to come up with. But the idea is try to make the situation the better as possible under the time limit, trying to have the solution ready very fast. So A bit about us. So Orbs is an Israeli company. We're the leading blockchain company in Israel. 40 people, around 50% of us are R&D. I'd say that almost all of us have an R&D experience. We're based in 4 locations around the world. Our headquarters in Tel Aviv, and also offices in San Francisco, Seoul, and Singapore. At 2018, we were chosen as a Gartner Blockchain Cool Vendor, which we're very proud of. And our mainnet launched last March. We're now working on, of course, constantly on addition, but the main major upgrade is expected very soon. I assume that most of you are well aware of what blockchain is. However, for those who don't, so I'll just go over it very briefly. So in my view, in our view, I'd say that blockchain, the technology's purpose and advantage is creating a single worldview in two key aspects. First of all is sharing data. Now this shared data would be a source of truth between multiple parties who do not necessarily trust each other. Based on that data, we can run certain computations carried out through software code, meaning smart contracts, and this is also done transparently. So both provide a new level of transparency, and again, trying to create a single source of truth and a single worldview on which we can both or multiple parties agree upon and work together into either solving a problem or promoting or trying to tackle a certain challenge. Moreover, the guarantees provided by the blockchain, again, this is key, are immutable, meaning that they cannot be changed, and they're tamper resistant, making the platforms in terms of security very reliable ones. In Orbs, our goal is to provide a corporate-grade blockchain aimed at large enterprises, governments, large NGOs, which are the project that we're usually part of, and certain project with such organizations at the moment. So of course, it's a decentralized platform, serverless cloud. It's a complete blockchain stack based on a Byzantine fault consensus algorithm. All our technology was developed in-house. It's highly scalable, mostly if the term says anything to it horizontally, by meaning opening up new virtual chains as you go, which is again a very strong feature. And of course, smart contract execution. And another aspect would be supporting both a permissionless deployment or permission deployment, meaning very generally a public or private blockchains. Obviously, for the solution that I'm about to explore right now is we believe that the permissionless solution is the right form of deployment. So a short background, again, I talked about what was our motivation. In terms of, some data about COVID, which I doubt whether someone would be surprised by the general trend, but I have to say that I was surprised going into this, researchers about the level of impact. So first of all, obviously, this is a global recession. As you can see in this graph by the World Bank, unfortunately, 2020 is a record breaker in terms of number of countries that are going to have a negative GDP growth. As you can see, the former record years were either the years, this great area at the end of World War I, another one at the early 1930s, and in the years at the end of World War II. Of course, this peak is 2008. And again, unfortunately, we're going to have a record this year, of this performance. Going into details of actual numbers and figures of countries. So I found also this graph, not only as the general trend, right, that most countries would have negative, or almost all countries would have a negative growth, but just to see the impact and how deep is this negative growth is. And again, what I found interesting in this chart is the effect of a second wave, right? And the the variance in which different countries would be affected. But again, mostly we're seeing that the countries, a lot of countries are in the high single digit, quite a lot, or even in the double digit. So obviously, this is a very tough year, which is to say the least. In terms of travel restrictions, so this is a map that I took from Kayak yesterday. We can see, the survey. So out of 230 countries which they surveyed, so almost 40% are completely closed, right? Meaning that they only allow citizens in, and additional 40% are partially closed. Now, from quite a lot of countries that I know of that are considered as partially closed, in fact, they are completely closed. And I know of quite a lot of countries that their official policy is that, for instance, for residents, I mean, most of the countries that I know of, they allow citizens in, whether most of them, of course, require some sort of a quarantine or stay-at-home notice. However, even countries that are partially closed, they do not allow residents back in. Of course, not for business or tourism. It has to be a very good reason why they will allow a person in. So we're seeing practically a situation in which travel is almost not an option, only for very, very, very specific reasons. The effect of this restriction is this graph showing, right, up until mid-March, early mid-March, that the data and the amount of flights was about the same as previous years, but then the sudden drop. And even though it seems that it's picking up again, unless countries open up, it's not likely. I even read some forecasts that it might take, I don't know, 2 to 3 years at least for this industry to get back to its original levels prior to COVID. So after that long introduction, I would like to discuss an overview of our solution. So the need is obviously quite trivial, right? How can you enable safe international travel and make it as much as possible under standards of health status guarantees? And how do you allow individuals to prove their health status, their COVID health status, in order to enter countries? Now, this may be either for a simpler procedure for citizens to come back to their homeland, or for visitors or any other type, whether business, talking about the recovery of the tourism sector might be a bit far-fetched, but even that, right? And how do you generally allow people into your country in the safest way and easiest way possible? So the challenges were, how can you do that using real-time verification of the test? How can you authenticate the test, not only in terms of the reliability of the test, but also is this test updated? Maybe it has been revoked. Maybe it's found that a certain batch there was a mistake. Let us keep in mind that we still there's a lot of general uncertainty about the test. How long does it take for a person who has been infected to be identified as one, right? Most of the tests are statistical. So you have the false negative, the false positive, etc. And one of the most, for us, the most important aspect, and one of the main reasons that blockchain is a solution here, would be privacy concerns. By the way, I didn't refer to questions, so I'll try to answer as many. I have a list of some questions. I'll try to address them during my discussion, but afterwards I'd be happy to take specific questions from the audience. So as I mentioned, privacy concern was one of the main reasons that we find blockchain is necessary here, meaning that how do you protect an individual's privacy, both in terms of the result being on some sort of a registry? How do you able to make the path, to track their path at the destination country, to keep that private so no one could track them later on. So the platform requirements, as derived from the need and the challenges, was to create some sort of a test verifications for labs, the procedures they go, the global standards that they adhere to, the countries, and also verify test results and being able to link them to a certain individual, again, without sharing private information about that individual, where he's been, when, etc., which countries, and so on and so forth. So the solution that we came up with was basically a combination of two main registries, both over a public blockchain. So one would be the certificate registry, and the other would be a trust registry. Both are constantly communicating with each other and allow and are linked in order to build a fuller picture of that person health status at the moment, based on the COVID-19 test results that he was able to present. So the trust registry is practically a registry of all the entities, meaning labs, that were registered over the blockchain. Now, these registries apply for endorsement, either by governments, by health organizations, whether national or global. And the idea is for them to get an approval that the procedures that they're running and the way that they're conducting COVID-19 test results is indeed acceptable and complies with the standards. Very important aspect is that these licenses or these endorsements may be revoked at any time. And because this registry is publicly open and available for anyone to watch, so, and again, our assumption would be that each country would focus on the labs and institutions that run the test within their country. So let's say, you know, our assumption would be that country A would not look into country B's labs, right? And each lab would ask for a local endorsement. The ones who could get the global endorsement would be obviously as trustful as can be, but then each country would have to figure out which are the governments, the local health institution that it trusts, and based on that, they will be able to endorse, based on that referral, they will endorse labs from the other country. The second registry is the anonymized test certificates. So over there, tests are recorded. Now, again, it's up for decision, up for discussion, but basically the idea is the entire test results would be recorded on this certificate regarding any other metadata that is relevant, whether time, whether you know which kind of protocol the test was adhered to, any other metadata you can think of, right? Some tests, the result is a probability, right? And based on this certificate and based on the lab that conducted that test, you can even generate some sort of a score to that specific test, right? How reliable do you consider it to be? Now, a very important thing here is that the personal information of the person tested is obviously not going to be on this as part of the certificate. It may be, of course, encrypted, the hash of the information. The idea is that you cannot directly link a certain person, you cannot reach a certain person only by reading a certain transaction or a log on this registry, right? This is the key important feature of this, of our solution. The third element would be an application, obviously on a mobile device. And that application would be, of course, personal and will hold all the person's details, information, and the link to this certificate registry. So whenever a person shows you their test results on that application, only then will you be able to link that person to the registry. From that registry, you will be able to see who was the institution, who was the lab who conducted that test, all the relevant information, and of course you can connect to the trust registry in order to get all the information that you need, the reliability of that institution, etc. Now, I would like to present the flows of the procedure. So the first flow would be a lab registration. So as I mentioned, certain labs apply for endorsement as a trustworthy COVID test entity, asked to be registered over the blockchain, over the trust registry. Some entities, okay, may or may not endorse it. If they endorse it, it will be, the idea is to have it publicly available for everybody. So for instance, if I plan on traveling to a certain country, I would know in advance whether the lab that I plan on conducting the test, or if I had the test already, is that lab recognized by, is it endorsed by the local health organization? Yes or no. So there would be no surprises. Now, even if it is endorsed right now, there are no guarantees that tomorrow this might not change for some reason, whether, I mean, even my test can be revoked, even the license can be revoked. But the thing is that because it's all on the blockchain and every endorsement is documented, then revoking it is a very simple procedure. And this is very important because, again, other than just coming up with a certain, piece of paper saying, here's my test result, how do I know, or how can someone tell whether this result isn't valid anymore? I'm not talking about fake, but maybe there was some problem in certain batch. Maybe the lab was, for some reason, revoked due to some false procedure that they're holding. So this is a very, very important, the preliminary, or if I may say, the process that is running in the background, in which labs are constantly trying to register and get the endorsement. And again, this is where if a certain lab is endorsed by more and more organizations, obviously their reliability is a lot higher. The next flow would be the test prior to the departure. So let's say, again, I plan on traveling to a certain country. First of all, I checked whether the lab that I plan on testing, is it endorsed in that country? Now, assuming that it is, and I am tested, the certificate, if you remember, there's the application and there's the additional registry. So first, the result, the full result, including all my details, are sent to my application. The certificate that, and the timestamps and digital stamp that I was tested for COVID at a certain lab at a certain time, and only I have the full information. In parallel, the records, the anonymized record of this certificate are also registered over the certificate registry. Now, again, this holds a lot of information all on the test, on the metadata. However, it only contains a hash of my personal information, so that by going over the data and all the tests are recorded over this registry, no one can trace back who's the person whose test is now, he's now monitoring. With your permission, I'll just briefly go over, I see there are some questions, so. Sophia, how can I reach the questions?
You can click the Q&A, or I can ask them to you, whatever you prefer. But if you click on the bottom of your screen, you'll see Q&A.
I click and nothing opens up. Sorry for being, if you can, I don't know, maybe the first two so I can refer to them.
Yeah, absolutely. So we had someone ask, is the solution at deployment level? And secondly, how many countries are involved at present?
It's still not in deployment. Obviously, there are a lot of aspects that needs to be clarified prior to that. We're currently talking to one government, but I'll get to it very soon. I think that the main barrier would be getting, again, whether it's this solution or another one. I think that the first to market would have, they usually have a great advantage, right? But I think that if the solution, and this is our goal, by the way, to provide a solution that is open enough and convenient enough, so as soon as, at least if it's deployed at one country, it will be very, very, very easy, and it would make a lot of sense for additional countries to join at a much, much lower effort. So I hope this addresses the question. So I will get, before we get to the additional questions, I'd like to proceed, that's okay. So the last flow would be the passenger on arrival at the border control. So here, and again, even this opens up a lot of questions, right? For instance, is the health passport mandatory, right? A certain country may demand everyone who wants to visit to have this health passport. So this is one of the aspects that, for instance, we left open up for decision because we're not in the position to decide. But obviously, this is a very big question, and it's out there. So let's assume that a person of course, has the health passport, and he arrives at the border control. He shows this application. He shows the certificate. The person at the border control officer verifies that this is indeed a legitimate test. It is indeed. It was carried out by a legitimate lab, et cetera, et cetera. However, and now he has two options. One option would be, okay, I'll let you in. Everything is fine. There's no need for anything else. You can go in. Another would be that for some reason, and again, this is where the country, the immigration, has their prerogative to have some heuristics, right? And they can see, okay, if the score is not high enough, but I came from country X, I can get in. If the score is high enough, but I came from country Y, I may not come in, right? So this is where, and now this is again up for the country to decide what are the requirements and what would they like to know about the traveler trying to get in. So it's completely up to them. But either way, they have all the information that they need. So one option would be, okay, you can go in. Another one would be, in some cases, the person would be asked to have a COVID test on the spot. Now, obviously, that test would be conducted by a national endorsed lab. So this kind of gets us back to the procedure in which the result, and assuming that everything is okay and the person is allowed to get in, so we go through the similar procedure as was previously explained. Now, again, I get an updated certificate on my application. This is also recorded in the manner that I explained over the blockchain, again, anonymized as discussed earlier. Now, this is where it gets interesting. So let's say that I want to visit a country. Everything was fine. I got in, they accepted my certificate. Everything went flawlessly. Now I want to go to the hotel, or doesn't matter, wherever I want to go, and I'm required to present my certificate, my health passport, and prove that, that the test I have a test an updated test, and it was approved by the local government, the local entity. So I just share this certificate, this digital certificate, and the place I'm trying to enter, right, within the country, they can now verify on the blockchain the same as the border control has. However, and this is the privacy issue that I mentioned earlier, because it's only a read request, right, and as it's digital, they do not have to confirm with the lab. So for instance, an alternative might have been that they, on the spot, they need to create some sort of request, whether through an API, doesn't matter, and they would have to get the lab's confirmation whether the digital certificate that I'm now presenting, is it authentic, yes or no? Now, that might be a very severe infringement of my privacy, because not only would the lab know my entire track, my entire path, this is documented. So when this is carried out over the blockchain, the read process, right, the reading of trying to read a certain transaction is not documented anywhere. So we've eliminated the main issue of privacy, because I have the full process of being approved. I have a valid and updated certificate. However, no one can track my path, and I'm able to maintain my privacy without being, while presenting all the information I was asked to regarding my COVID health status. Now, as always with the blockchain project, the main question that comes up is why blockchain? I think it's very important, and I can tell you that this is the hardest question in every project that we're involved in, because blockchain, again, is great technology, very interesting, but it's very new. And I think that naturally, most people still do not fully understand it, do not understand the potential or what it can do. As a result, and again, this is like a discussion that always comes up. Are we trying to solve a problem that can be solved just as good without blockchain? And in my opinion, if you can solve something without blockchain, it would probably be better, faster, and cheaper. Now, even though, right, my job is to promote blockchain business, we always, our philosophy is that we do not want to get into a project in which we're not convinced that blockchain is necessary. Now, so that would be probably the most important question we ask every time. I think here, at least we were able to convince ourselves and another government, hopefully. So the first reason that we believe blockchain is the right technology is the ease of implementation. And ease is not only the solution itself can be deployed rather easily, but also rather fast. So that would be a decentralized global registries, right, in an infrastructure that already exists. The standards are pretty much out there. All around the world, it's accepted what is a proper COVID-19 test. Even if there are several standards, they're all pretty much accepted. The solution can start locally, but then can be scaled globally rather efficiently, because all it would require, right, the trust registries, the ones with all the labs and the endorsement is practically, I'd say, country agnostic. It's just out there and anyone can join. Whether they get the endorsement, yes or no, is a different question, but any lab can join all around the world. And then once you have the standard for the certificate registry, and again, this is where the first comers, the first to market would have great advantage. Other countries would probably adopt these standards. So it's very easy, and they would have their own interfaces based on the same database and the information they're willing to share. In terms of trust, so it's very, very, very transparent and independent, because, and this is key here, right? We're seeing countries in which government are not as transparent as they should be. And I think that the way they handle COVID is not as successful as countries who do share all the information and trying to be as transparent as possible, governments, right? So this allows for governments to share the information, and practically they're not risking anything by sharing information, because the information that is practically shared is the information about labs, right? Which I don't see any problem in sharing, right? And the test itself, which is, even if some would consider that to be some sort of a privacy issue, but the fact is that you cannot link that. It's only one directional, right? From the app to the certificate in order to identify and be able to link a certain test result to a certain person, unless you have the application. So there's no real privacy aspect here. In terms of privacy, right, because everything is stored on the blockchain, there's no need for interaction, right? And there's no, as I mentioned, there's no documentation and there's no need to interact with the lab that conducted the test whenever you want to verify whether the certificate that I'm now showing you is valid or not. So again, my privacy is kept at a very, very high level. Another important aspect, again, because everything is documented in terms of the lab endorsement, etc., and of course the certificate itself, you can very easily revoke both in case there was some problem. So whether you found that there was some problem with the lab, you can revoke their license until they're able to, explain what was the problem, in case they are able to. And of course, a certain test, let's say I was tested at a certain time where there was a very specific problem with the batch, there was an error. So you can very, very, very easily revoke both. And again, this is only something that can be done where every action is documented and has its validity. And again, last is publicly available information, which connects to the trust not only between countries and the information they share, but also it's available for the public, right? So let's say I know which lab is mostly endorsed. Generally, I know which lab is endorsed in the country that I wanted to travel to. Countries may even share their entry policy, right? Saying, we recommend doing this. If you want to visit us, don't go through that country, whatever. They're able, based on their judgment, their heuristics, whatever, they're able to share the policy. And I think, in today's, I'd say, uncertainty, any additional information you can have that is not trivial and you did not have before and is immutable and tamper resistant would obviously have great value in any decision that you make. So this is thank you very much. This is practically what I have. I'd be very happy to take questions and talk more about it.
Excellent, thank you, Ran. We have had a few questions come in, so I'll just start off from the top. Somebody said, perhaps I missed this, but how do you rank the testing institutions and who does the ranking?
So the ranking would be it's not by the platform, it's a feature. It's done by the health organizations. Let's say we have Mayo Clinic and you have Rand's Clinic. Now, the US Health Organization or the World Health Organization may decide to give me reliability of 1 and Mayo Clinic 10. So it's completely up to the one who's ranking these labs, and it's up to their discretion. Okay.
We also had someone ask, well, first, congratulate, a very impressive concept, and is asking, have you considered using FHIR as the certificate exchange standard?
FHIR? I'm sorry.
Which is Fast Healthcare Interoperability Resources.
I'm sorry, but I'm not familiar with that. I think, I don't know, maybe it's basically, again, this concept that the product that we're developing is based on some very, very, very basic concept of digital ID, whether W3C. So as a philosophy, we're not trying to reinvent the wheel. So if there are some standards, and again, the implementation and deployment is in very, of course, close work with that country's health ministry of health. So if there are certain standards, then obviously we would use them. The idea is to bring in blockchain and make things easier. As a philosophy, we see no value in reinventing the wheel. So if again, I'm not aware of that standard, but if it is and it solves the problem, we'd be very happy to adopt it.
Okay, what we'll do after this webinar, we'll share a recording and put you in contact with Orbs. So if you have any additional and more specific questions, I'm sure someone on the Orbs team can, in addition to Ryan answering them today, could help. Somebody asks, is your platform GDPR compliant? You've talked about privacy, but maybe you can expand a little bit on GDPR specifically.
Of course. So no personal information is recorded on the platform. So it is GDPR compliant. As I mentioned, you have several options, but for sure, no personal details will be saved over the blockchain. A hash, but a hash of your information, but hash is not considered anything that is problematic with the GDPR, as far as as we see it, as we understand GDPR. So the answer is, of course, no private information. Otherwise it won't fly. No one would accept it.
Right. In terms of testing, so there's some lags in testing, and then we don't necessarily know with this virus if you can become reinfected after testing, after maybe testing positive and then testing negative. So folks are wondering, with this lag, how do you address that? Say you've been approved to fly, you meet the country standards, but maybe upon arriving you test positive again.
Yeah, so this is an excellent question. To be very honest, I don't have an answer to that. I think that we still don't know enough about COVID-19, unfortunately. So much, uncertainty. Exactly as you mentioned, someone was infected, then he was tested negative. Is he a health menace? I don't know. I just don't know. I think that, again, it's a lot of learning as you go. I think that, however, having this solution available is, in a way, not dependent on the uncertainties, because this is something that can be later on adjusted, or and every country can decide for itself based on the heuristics that they define. So let's say one country would say, okay, if a certain time has passed, again, I'm not a doctor, I'm not a COVID-19 expert, so everyone can decide, each country can decide for itself. I assume that there will be a standard, but again, it will always be based on the validity of tests, the validity of the lab that conducted the test, and how you can link them very, very, very securely while maintaining privacy to a certain person. So once you have that infrastructure, then who do you let in? What is the lag between the tests, right? Like I can be totally, my test is negative. I don't have COVID-19. I had a test yesterday. I went on the plane. I'm still COVID-19 negative. However, the person I sat next to is COVID-19 positive. I was infected during the flight time, right? Now I will show all the test results that I'm fine, but I'm actually, without knowing, I'm COVID-19 positive now. So, I mean, this is a question. What happens if someone is stuck and is not let in to the country? Now he has to stay at the airport. I think that there are a lot of questions. Again, as I mentioned, this is not an airtight solution. This was not our intention. We thought of how can you have something that is good enough and can make the situation better, the current situation better, and would allow or even would provide each country to manage this risk better and understand who they let in, why and when. And there's still a lot to explore, and a lot of very important questions that need to be decided.
Absolutely, I think that's very important to keep in mind. As we come up on the hour, I do want to ask, is Orbs envisioning future applications for this technology beyond test results? As we come to know more about the best ways to mitigate spread through travel, do you plan to expand the platform to include other metrics, perhaps?
Yeah. So of course, again, the idea is, as I mentioned, we're a blockchain company. We're not a healthcare company, and we came up with this concept, and we were very happy to find out that there is a demand for such a solution. We are partnering with companies in order to further develop that. And I guess, as always, we're trying to figure out solutions for certain sectors, certain industries, but we're not experts in every industry. So I think that for us, the most important thing is to have a live dialogue. And as we learn more about the problem, so again, talking about with health expert about this solution, trying to figure out whether it makes sense or not. And if it does, then of course, we get a lot of new questions. Well, how do you deal with that situation? How can you deal with that situation? And then we can come up with hopefully blockchain solutions that can accommodate those solutions. But we did not think, I don't think anyone can self-proclaim to figure out all the challenges, especially we don't. But we do consider this, and I think as it evolves, right, and as it's deployed, we're going to have a lot of new questions, and I would say that I'm quite confident that we can accommodate most of them, if not all of them.
Absolutely. It's commendable for Orbs to rise to the challenge to apply this technology in a way that really is compelling, makes sense, there's interest, and then the approach seems to be just as important as what's available right now, to evolve it over time, to have a multi-stakeholder approach to creating this. Before we close out, I'd just like to offer you the opportunity to leave the audience with any last words, thoughts, or information about how to get in touch with Orbs.
So my email is ran@orbs.com. Again, we're providing solutions, blockchain solutions for multiple sectors. I'd be very happy. Again, the solution is mostly aimed at enterprises, governments, but we're open up for any business partnership. So feel free to reach out to me. And I'm very happy to keep in touch, provide additional information. If you have maybe, I'm sure there were questions that were not addressed, feel free to reach out to me, and I'll be happy to provide additional information, both on this solution and over Orbs platform in general.
Excellent. Thank you so much, Ran, for joining us and for sharing the solution with us. We will share contact information for Orbs as well as a recording to this video with everyone who registered and tuned in today. We certainly appreciate your time, and thank you for joining us from Singapore in what is your evening.
Thank you very much.
Excellent. And thank you to all of you who joined today's webinar and for your very thoughtful questions. We welcome you back on August 13th for a webinar with QR Capital, which is the largest crypto-focused hedge fund in Brazil, on growing the digital asset ecosystem in Brazil. You can also follow us online at LinkedIn and Twitter for regular updates, and we will be sure to share the information for Orbs and this webinar with all of you. Thanks so much.
Thank you, everybody. Bye-bye.